Hello, I'm Dr. David Jane, a family practice physician in the greater Oklahoma City and Edmond area, and today I'd like to introduce you to MD VIP. I know you're wondering where my solid colored shirt and my conservative tie is. I can tell you right now that the rumor is possibly true. There is a picture of me in that outfit. I want you to understand I was in foreign territory when it was taken. If you go to the link on the screen, you can actually see it. And I want you to realize that picture is probably about as rare as Bigfoot. So, that being said, what I'd like to do today is talk to you about a little more serious matter. I've been in practice for 19 years. During that time period, I have accumulated 3,000 patients, and I realize that you watching today are probably some of the most loyal patients, and I truly appreciate that. It's been wonderful taking care of you all this time. The problem comes that about a year ago, 3 of the major insurers decided to cut my reimbursements by 11 to 18%. And I've been struggling and dealing with that for over a year now. I've been trying to find out what's the best way to deal with that. I have a couple of options. One, I can try to take the 3,000 patients and increase it to 4,000 patients. But when I do that, I end up doing less and less for more and more patients. And what you get is less time with me, less focus with me, and less time to connect. I think that is the absolute wrong direction to go. My second option is I could sell to one of the hospitals and go to work for them, but then what happens is they dictate to me exactly how I have to practice medicine. And as you can see, I'm a nonconformist. Look at my shirt. So, I don't believe that's the proper route to go either. What I've decided is, in trying to solve this dilemma, the best way to go is for me to affiliate with a company called MD VIP. MD VIP is a company that was started in the year 2000 by 2 physicians who believe the same thing that I do, that wellness and prevention really is worthwhile, and they decided to establish a wellness and prevention program that they could take out to other physicians that could be duplicated and replicated across the nation. There's now over 600 MD VIP physicians across the nation. They have over 300,000 patients. Those patients, when they go from the first year to the second year of the program, 93% sign up again. That goes to show their support for the program. They also have a marked reduction in hospitalizations and readmissions to the hospital over patients who aren't enrolled in MD VIP. If you happen to be traveling and get sick in a major metropolitan area, I will be able to, once you call me, call them and get you in same day or next day just as if you were here. Another benefit of MD VIP is they have affiliations with 30 centers of excellence throughout the United States. And if you ever have a problem we can't figure out, or a complicated problem that requires treatment we can't get here, or you just need a second opinion, I make one phone call to MD VIP and they locate the national expert in whatever problem you have. And that could be at MD Anderson, Mayo Clinic, Sloan Kettering, any of the major institutions in the United States. So that really is a valuable service. MD VIP comes in and what happens is they help me set up a wellness and prevention plan specific to you with diagnostic tests, screening tests, and lab tests that aren't covered by insurance. These tests are then analyzed and you come back for a follow-up visit, and there we develop a wellness and prevention plan specific to you. We develop a shorter-term plan and a longer-term plan to help you achieve these goals. Well, that takes about 2 hours a patient. And if you take 3,000 patients times 2 hours, the math doesn't work. So what I have to do is reduce my patient panel down to 400 patients. Once I do that, then we now have the time to spend 30 minutes for routine visits instead of 10. We have the ability to take away the digital voicemail that we have, and we just answer the phone and ask, how can we help you today? It also allows me to do away with my answering service, and I give everyone my cell phone number. So you have availability to me 24 hours, 7 days a week. And with that, I can help keep you out of the emergency room, out of the after-hours clinic. There's lots of things that we can do once we have the proper time to connect. When you and I get to connect, your healthcare gets better. Under the MDVIP program, I am assuredly going to have much more time to spend with you, focusing on your health. There is a fee associated with this, and we'll be happy to discuss this with you. What I urge you to do is to contact Sylvia Hodges at our phone number on the screen, or go to the website link on the screen for more information. I urge you to do this fairly quickly. I only have 400 slots, and I'm really interested in keeping you as a patient and moving forward so that we can walk together on this process that we call life, and I hope to help you have the longest, most productive life possible. Thank you.